26 antibiotics. Joining me now, Dr. Elizabeth Meade from Swedish Medical. Good morning.
Good morning.
When you hear about a case like this, it is scary stuff. How common is this?
Scary. Well, you know, this kind of case where it's resistant to everything, luckily, is not that common yet, but we're seeing more and more of it. But each year in the U.S., about 2 million people become infected with bacteria that's resistant to some kind of antibiotic, and 23,000 of those people will die each year. So it's not uncommon for us to see something like this.
How do these things even form? The idea that they can be resistant to 26 different antibiotics.
Well, the problem is that we've just started to use antibiotics more and more in daily life, and so we are contributing to developing bacteria that are resistant to lots of the different treatments that we have. And frankly, it's not that profitable for drug companies to invent new antibiotics, and so it's often not a priority for them.
What can we do to protect ourselves?
That's a great question. I kind of think of 3 big categories. So I think as physicians, we need to be very judicious about prescribing antibiotics to people. So I want to be really clear, they do not work for colds, they don't work for viral infections. So if you have bronchitis or a runny nose, or even if your child has an ear infection often, these are things that will go away on their own and don't need antibiotic treatment. As patients, I think we need to be equally judicious about receiving antibiotics. So if you're prescribed something, it's always a good idea to ask, do I really need this? Is this an infection that needs to be treated with an antibiotic? And if so, is this the narrowest antibiotic that you can prescribe to treat this bacteria? And then the third thing I think is in agriculture. So antibiotic use in meats, animals that we are eating definitely contributes to resistance. So that's something we need to be really mindful and aware of. So if you can buy antibiotic-free meat, that's only going to help you.
Okay, great advice, especially that second one, because I think when you know doctors give you something, you're inclined to be like, okay, you just take it. But to ask those questions.
I think asking questions is always a good idea. I think we've really gotten into this culture where people want antibiotics, they want to feel better right away, and if it will help you, go for it. If you truly have a bacterial infection that needs to be treated, you should absolutely take the antibiotic. But if you've got a viral infection, like we said, a cold, a bronchitis, just a sore throat, a lot of times that's something that won't be helped at all by antibiotic treatment, and it actually can do more harm than good.
Okay, certain ages that are more susceptible to these things?
Yeah, I mean, again, like with every infection, the very young and the very old, so infants under 2, people over 65, anybody with a chronic health condition. If you're someone who's taken a lot of antibiotics in your life, if you've had frequent infections, if you've traveled to other countries that have higher levels of resistance, these are all things to be aware of and talk with your doctor about.
Okay, Dr. Meade, thank you so much for being with us this morning. We appreciate that advice. All right, well, there you are, Rebecca.